2020 brought to you by Wockhardt. I am Dr. Ruchi Shah, and on behalf of Wockhardt RSSDI TV 2020, I welcome you all. I am glad to have with us today renowned diabetologist from Mumbai, Dr. Siddharth Shah, sir. Sir is a very senior diabetologist with clinical experience spanning over 40 years in his practice. He is a professor of medicine and diabetology, Sir H.N. Reliance Foundation Hospital and Research Center. So, sir, based on your recent talk in RSSDI 2020 on hypertension and diabetes, a deadly duo, we would like to know from you what is the importance and the association of hypertension and diabetes in the COVID times?
You all know that since last 9 months, the country is facing a very severe epidemic of COVID. And in this COVID, people have realized that the hypertension and diabetes is playing a major role in the complications of COVID-related illnesses. Hence, we all know that diabetes and hypertension can coexist or can be, patients can be suffering with either diabetes or hypertension. But one must realize that almost 60% of diabetic patients are hypertensive, and hence this becomes a deadly duo in this COVID pandemic. And it is very, very important to understand that this diabetes and hypertension has its core insulin resistance. Hence, we have to be extra careful in patients who have this comorbidity of diabetes and hypertension, because patients suffering from diabetes or hypertension have a very poor prognosis if they suffer from COVID 2019.
Thank you, sir. So, sir, the next question is, what are the differences between the hypertension and diabetes?
We all know that hypertension and diabetes has added as its core insulin resistance. It's a part of a metabolic disorder, and there are very subtle differences between diabetes and hypertension. We all know that patients suffering from diabetes and hypertension are all, we know that diabetic is, type 2 diabetics are all above the age of 30. Then the manifestation of both diabetes and hypertension is silent. Many of the patients come to us telling they don't have anything, but on a routine checkup, we find that they have diabetes and hypertension. And patients with diabetes and hypertension also have a genetics as its core. So we have people having a family history of hypertension and diabetes. Epidemiologically, incidence of hypertension is much higher than incidence of diabetes. Approximately in 2020, the incidence of diabetes is around 78 to 80 million, whereas in the incidence of hypertension, pathogenesis of hypertension, diabetes, insulin resistance remains the core as a part of metabolic disorders, and the complications of diabetes are micro and macrovascular diseases. But in hypertension, the maximum complication due to hypertension is CNS complaint like stroke. Whereas in diabetes, it's the vascular complications, macrovascular complications are known with diabetics. And the prevention in both the diseases remains the same. That is the lifestyle modification. And adding to that, if required, medications are started in both the diseases. Some of almost 10 to 15% of diabetic and hypertensive patients can be reversed with the help of diet and exercise, that is the lifestyle modification, and the patient may not need medicines at all. So hence, one has to be very, very alert in controlling diabetes and hypertension. And the diabetes related complications are more of vascular. There's the microvascular complications like nephropathy, neuropathy, and retinopathy, whereas the macrovascular complications are related to peripheral vascular disease, heart complications, and neurological complications, brain complications. This is the commonality of diabetes and hypertension and the risk that both have uh, to be treated well, and medications have to be given as per the advice of the treating physicians. Both needs more than two drugs for control of diabetes and hypertension, and one has to, and both will need combination therapy for adequate control of diabetes and hypertension.
So, sir, the last question: what is the role of obesity in hypertension and diabetes?
As we said, diabetes and hypertension are both metabolic disorders, and obesity also is a part of metabolic disorders. And patients suffering from obesity have almost 50% chance of developing diabetes, whereas in obese patients, hypertension is found to be present in these patients, in many of these patients. So I feel that obesity may be a core of a metabolic syndrome giving rise to diabetes and hypertension.
Thank you so much, sir, for sharing your views on this important topic and throwing the light on
Thank you.
hypertension and diabetes. Stay tuned to RSSDI TV 2020, brought to you by Wockhardt, for more recent updates from the RSSDI 2020. Thank you very much.